My name is Dr. Neeraj Saraf and I'm Senior Director and Head of Clinical and Transplant Hepatology at Medanta Gurugram. So viral hepatitis is generally of four types, the ones which we see in our country. Hepatitis A and E, which are waterborne, and hepatitis B and C, which are spread through blood or through intravenous routes. So hepatitis B and C are the serious types of viral hepatitis which we need to worry about. So A and E, like I said, are waterborne and they are generally self-curable, and a patient becomes or a person becomes better in a few weeks. Hepatitis B and C can lead to chronic liver damage, which can further on lead to liver cirrhosis or liver cancer. So these are the viruses which we should screen and which we should be worried about. So let's answer these separately. So about 0.5 to 1% of the population has hepatitis C. We can see this prevalence going down now with the advent of very good treatments available. As far as hepatitis B is concerned, about 4 to 5% of population in India has infection with hepatitis B, but I must clarify that all of these 4 or 5% people are not having disease. So they may be just infected with hepatitis B, which is like a silent infection. It just stays there, does not cause any damage, and these are usually called carriers. So 4 to 5% of the population has hepatitis B, but all of it may not be dangerous. So like I said, hepatitis B and C are spread through blood, they are spread through injections, needles, they are spread through sexual contact, they are spread from mother to child during birth. So the medical community is definitely at risk because we are dealing with patients, so nurses, doctors, surgeons, we are at risk for hepatitis B and C in case you get a needle prick. People, commercial sex workers are at high risk for developing hepatitis B and C. People who are getting frequent transfusions, children or adolescents with hemophilia who get frequent transfusions are at high risk for hepatitis B and C. Yes, so hepatitis B and C can cause liver cirrhosis, and they can cause liver cancer, and they can cause end-stage liver disease, which is also called as liver failure. So and that is why these viruses must be looked for, screened and treated early in the course, because if we don't treat them, they will lead to cirrhosis in almost 80% of the patients in a span of 15 to 20 years. So yes, they can cause liver failure, and they can cause jaundice, they can cause ascites, which is water in the abdomen, they can cause delirium, altered mental status, they can even lead to coma, so yes, both these viruses can cause advanced liver disease and liver failure. Yes, they are common causes of liver transplantation because they cause end-stage liver disease, liver cancer, liver failure. But fortunately, with good treatment and with probably some effect of hepatitis B vaccine, the prevalence of hepatitis B and C is decreasing worldwide, and in a lot of countries actually hepatitis B has been literally eliminated. In our country also, I think it's coming down, so it is a lesser common cause of or indication for liver transplant now as it was 10 years ago. But yes, I would still say that hepatitis B and C constitutes about 1/4 of the indications for liver transplantation. Very good drugs are available for treating hepatitis B and C. So let's first talk of hepatitis B. So there are various tablets available, and these can decrease your hepatitis B virus load in a few months to almost zero. But what is important to know that these drugs have to be continued for a long time. So if you stop these drugs, most of the times hepatitis B will come back. So it's something which it's not curable, but it is controllable. So it's something like diabetes or blood pressure, you have to continue taking the medications. But if you continue taking the medications, the virus remains in control, and a person is usually safe from any complications of this disease. As far as hepatitis C is concerned, there has been a revolution in treatment. So till 2015, there were injections available which were very toxic, had a lot of side effects, and had a cure rate of only 30 to 40%. In the last 5 to 7 years, we have excellent oral medications available. These are single tablets which are to be taken only for 12 weeks, and unlike hepatitis B, hepatitis C can be cured. So once you've taken the treatment, it doesn't come back. You can stop the treatment at 12 weeks and you are cured of it, and you don't need to take any long-term treatment. So hepatitis C treatment is excellent nowadays. It's just a 12-week treatment, and almost 98 to 99% cure rates are available. So that's a very valid point. So unfortunately, there is no vaccine for hepatitis C, but like I said, very good treatment is available. So if someone gets hepatitis C and is detected early, just get it treated. Hepatitis B, yes, there is an excellent vaccine available, which is now part of the universal immunization program as well. So all newborns get it. It's a 3-dose vaccine, so you take it at 0 point at 1 month and then at 6 months, and it offers more than 95% protection against this deadly disease. So everyone should get vaccinated for hepatitis B. Thank you.